Hello, and welcome to JAMA Health Forum Conversations. I'm Dr. Sandro Galea. I have the privilege of serving as Dean at the School of Public Health at Washington University in St. Louis. I also serve as Editor-in-Chief of JAMA Health Forum, a peer-reviewed open-access online journal focusing on health policy, health systems, and population health, one of 12 specialty journals in the JAMA network. This is a volatile time for health in the US and globally. The first few months of the Trump administration have brought a flurry of actions that have affected health, including mass layoffs at the Centers for Disease Control and Prevention, a pause on federal funding for global health, a shuttering of the U.S. Agency for International Development, and withdrawal of the U.S. from the World Health Organization. The administration has also appointed to positions of leadership figures whose views fall outside the mainstream of public health thinking. While some of these actions remain contested, it seems likely we are entering a time of uncertainty for health, characterized by a disinvestment in many of the structures that support healthy populations. Here to help make sense of all this is Dr. Josh Sharfstein. Dr. Sharfstein is Distinguished Professor of the Practice in Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health. He has served as Secretary of the Maryland Department of Health and Mental Hygiene, the Principal Deputy Commissioner of the U.S. Food and Drug Administration, Commissioner of Health for Baltimore City, and as Health Policy Advisor for Congressman Henry Waxman. He's an elected member of the National Academy of Medicine and the National Academy of Public Administration. Dr. Sharfstein, thank you for being with us.
Thanks so much for having me, Dr. Galea.
So let's start with asking you about a topic that's central to the moment, vaccination. You recently wrote a piece for JAMA Health Forum called Recognizing and Strengthening the Four Pillars of U.S. Childhood Vaccine Policy. You start the piece with a story of the Burton hearings. Tell us a little bit about those hearings.
So the Burton hearings were named for Dan Burton, a congressman who chaired the Committee on Government Reform of the U.S. House of Representatives at that time. He was very concerned about the safety of vaccines. He had a grandchild with autism, and he was concerned that vaccines might be causing autism. This was in the era of the paper by Dr. Andrew Wakefield alleging that the MMR vaccine could cause autism, and the era of concern over thimerosal as a preservative in vaccines. And Dr. Wakefield and others came before the committee to tell stories of their concerns about vaccines, and these concerns were widely publicized.
Now, the Burton hearings, although they were high profile, did not lead to a sharp decline in U.S. childhood vaccination rates. What is different about the anti-vaccination movement today? Is this movement more influential, and why?
Well, I think there are a number of factors. The first is that there were some very compelling arguments that were made that the concerns that were raised were not justified. And those arguments were made not only by scientists at CDC and scientists in academia, but the National Academies of Science, Engineering, and Medicine did a very, very careful study of all of these allegations and found that they were without merit. So you had the scientific community very clearly responding, but at the same time, you had a different, what I would say, information environment. You know, the media was covering what the scientific community said. There was not social media at all. And so it was portrayed as people were raising questions, but there were answers. And the effect in the United States was that these allegations did not cause a panic. You know, over in Europe, a lot of people stopped vaccinating and there were measles outbreaks, but that never happened in this country. Today, we're in a different world. We're in the shadow of COVID, when there was an enormous amount of politics around vaccination. We do have social media where people who can say whatever they want about vaccines can develop a huge audience. And we're seeing the differences in our environment play out in how these issues are being handled, even though there have been more than a dozen strong studies that fail to find a connection between vaccines and autism. That issue still lives. And as we've heard, the Secretary of HHS wants to do more research on it and continues to raise questions about it. So we're just in a totally different world than 25 years ago. If you had told me 25 years ago that we'd still be dealing with these very same allegations, I don't think I would have believed you.
Yeah, and you introduced COVID. I was going to as well. You know, COVID moment was challenging for institutional public health and vaccine skepticism. You addressed the first of these reasons, I think, which is that digital media provided powerful platforms for people who are vaccine skeptical. And second, probably public health also struggled to engage with good faith concerns about vaccine around COVID. You also mentioned the polarization of the moment that has made things worse, and arguably, we're still dealing with the collapse of trust that characterized COVID. I suppose my question is, does that feel like a correct characterization of the past few years? And whether it is or not, and how else would you edit it, how can we in public health do a better job of addressing these forces once we understand what has happened in the past few years?
Yeah, I appreciate your formulation. I would say that I do think that there were things that the public health community could have done better during COVID, but I do not think that those things would have headed off the moment that we're in. There was a very strong and growing anti-vaccine movement before COVID. They were really ready to capitalize on COVID, and they were able to do that. I don't think they would have gone away no matter what public health did. But I do agree that there were moments when public health was more transparent about the vaccine. For example, the initial approval, there was a big advisory committee meeting. All the data about safety was discussed openly. But then as further decisions were made, like around the boosters or even around the vaccine for children, there were periods of not a lot of transparency, with not a lot of discussion. And I think that led to a void where a lot of misinformation really flourished. And then I think there were the mandates, which certainly helped a lot of people get vaccinated, but sparked a big backlash and were primarily responsible for the alignment of politics and vaccines. And I should just say, for many years, vaccination was not a partisan issue. We didn't think of, well, clearly the Democrats have this position and Republicans have this position. When I worked on that committee staff during the Burton hearings, there were Democrats and Republicans raising questions about vaccines, and there were Democrats and Republicans who were working with the CDC to get the answers to those questions. But today, in part because of the mandates, I think this has become more politicized, and I think that's a legacy we're living with.
Let's jump to the present for a second. Many in public health are concerned about the appointment of Robert F. Kennedy as Secretary of Health and Human Services. And in particular, I think our concern is how this could affect the country's public health infrastructure. You wrote a piece in The Hill in December addressing some of these concerns. Can you talk us through some of the ways in which the HHS Secretary can and cannot influence vaccination, health policy, and the regulations that matter for health?
Sure. Well, part of the concern around Secretary Kennedy has to do with the fact that he comes from an organization that has made a lot of misleading and false statements about vaccination. We're in the middle of a measles outbreak right now, pretty serious one with 2 deaths so far. And what he is saying isn't really consistent with a lot of public health guidance about the importance of the measles vaccine and stopping outbreaks. So concern is high. And the question is, well, what could a health secretary do to undermine vaccination? And the good news is that there are laws that have set up some really important pillars of vaccine policy. This is what we wrote about in JAMA Health Forum. But it's also true that each one of these pillars is adapted by the administration, and we have to keep a close eye on how that's going. Doesn't mean things are perfect, doesn't mean things can't be improved, but it also doesn't mean that things will be as stable as they are now. And so one of the things that the federal government does is support research. And we've just seen that the National Institutes of Health stopped all of the research projects on vaccine hesitancy and said it's not a priority to understand why people have chosen not to be vaccinated. That, I think, is concerning if you believe that we want to have a robust vaccine program because it helps protect everyone in the community, including people who are carrying on with different kinds of chronic and severe conditions. There is the vaccine schedule that's established by the CDC. And on the basis of that schedule, insurers pay for vaccines, and vaccines are made available to half the country through the Vaccines for Children program. So if there are changes to that infrastructure, that could have a huge impact on who can be vaccinated. There are other kinds of efforts related to vaccination. The HHS runs the National Injury Compensation Program, which is a really important program that pays families when there are rare but severe side effects of vaccines. It's really important. That program can be run effectively. It can be run in ways that make people wonder whether there's fairness to the vaccine compensation system and frustrate people. And so it's really important at each of these parts of the overall system to be watching not just, how the law is written, but how it's actually being implemented.
Let me try to shift tack for a second before we conclude and look at the future. So you've written about the role of artificial intelligence in medical diagnosis. Can you talk a little bit about AI and emerging technologies, which you hinted at in your last answer, and policies that can help us actually support productive, useful use of AI?
Sure. I'm happy to talk about anything other than vaccines these days for a quick minute.
Yeah, I was trying to throw you a lifeline, yeah.
Yeah. So artificial intelligence is very exciting in healthcare and has a lot of potentially really important applications, but it is really only as good as the data upon which it is based. And so there's a lot of excitement around medical diagnosis using AI. The idea that, well, maybe we can have a AI tell us what the patient is suffering from in a way that's better than doctors today, or maybe equivalent to the top diagnosticians. But it really depends what that AI is trained on. And if that AI is trained on a data set that's certainly biased, that's a problem. It's also a problem if that AI is trained on a data set of sort of average diagnoses, which could be wrong. So if the diagnoses that it thinks are correct and it's training itself on are actually incorrect, then it's never going to be as good as the best diagnosticians. And I wrote a piece with Dr. David Newman-Toker in JAMA Health Forum talking about the importance of those underlying data sets. Because if those data sets are well constructed, then AI will have the best chance at actually giving better diagnoses. And we think that there's a role for the government to fund the creation of high-quality data sets, as well as to regulate the AI based on whether the underlying data is really top-notch or not. And that could be the difference between a diagnostic aid that is right and a diagnostic aid that is wrong.
So unfortunately, that answer also brings us back to the current moment, because you made reference to this in your piece. You talk about NIH's role in developing databases to train AI systems. Can you talk us a little bit through potential threatened cuts to NIH funding and how that threatens our ability to leverage technologies like AI?
And I'm not going to resist going back a little bit to vaccines here. I think that the scientific effort is to constantly get better and to constantly ask questions and constantly get better. That's what we do in science. That's what NIH plays such a central role in. And whether it's vaccines, which are very safe, but can be made safer, we need more research to be able to do that. We need to understand what people think about vaccines. And then we need to be studying different kinds of vaccines to figure out how to make them safer. On AI, we need to not just watch what happens out in the private sector, but invest in understanding what really works and what can make a difference for patients. And the NIH really is at the center of that scientific system in this country. And it's worrisome to see the staffing changes at the NIH, which don't certainly appear to be well planned. And it's worrisome to see what appear to be relatively arbitrary cuts in certain grant programs. And then, of course, there's the proposal to slash indirect funding, which takes the legs out of the infrastructure of the research enterprise. And we have accomplished so much in this country. We have, through vaccines alone, saved hundreds of thousands and millions of lives in the United States and around the world. And there's so many more lives to be saved, Sandra. There's so much more. There's so much suffering that people are still experiencing. And we have been following a path in this country of investing in science to reduce suffering. And it would be such a terrible tragedy for so many people if that path really starts to wither.
So I'm trying to find a positive to end us on. So you made the comment that science is about always getting better. So as we're dealing with the challenges the new administration is posing to the country's health infrastructure, do you see opportunities in the disruption of the moment to improve what we do and how we do it? Does any of that give you hope?
There is a faculty member I know who said, look, when there are big changes, it can be very, very difficult and painful, but we can hope that what comes out of those changes may in some ways be better than what we had before. And certainly we should be looking for all of those opportunities right now. I don't think that anybody would say that all the systems we have in public health are the best that they can be. And our goal is always to see them improving, whether it has to do with vaccines or artificial intelligence or any other topic that we're working on. It's pretty early on in the new administration. And even though this has been a very difficult couple of months, I think it's still true that there's a lot of uncertainty about what's going to happen. We barely have political appointees getting in place. And it's really important for people to remain engaged and to be talking not only about what was lost that maybe should be restored, but also what can be done that wasn't within the realm of possibility before. And maybe there'll be some new ears and interest in taking on over the next few years.
We shall take that as the hope we can find. Thank you, Dr. Sharfstein. I'm Sandro Galea. I'm along with Dr. Josh Sharfstein. We have been talking about current changes to the national public health infrastructure and their implications for health in the US and globally. You can find links to articles by Josh and by myself on these topics in this episode's description. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com, jamahealthforum.com, or look for JAMA Network wherever you get your podcasts. Thank you for being part of the conversation.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.